Wonderful share community, and welcome to the program Vicarious Trauma, Burnout, and Self-Care. For those of you who I haven't had the pleasure of meeting, I'm Andrea Herzberg, SHARE's Ovarian Cancer Helpline Manager and Ovarian Cancer Support Group Facilitator.
Hi, and I'm Victoria Goldberg. I see a lot of familiar faces, but for those who don't know me, I am a long-time support group facilitator for the MBC program here at SHARE, and I also produce and host a podcast, Our MBC Life.
It's great to see so many volunteers, ambassadors, and staff members on this Zoom, and thank you for joining us to discuss this important topic. We kindly ask, and this is obviously timely, kindly ask that you stay muted throughout the presentation, and also if you're not speaking during the Q&A.
Once Sarah, our speaker for tonight, finishes presenting, we'll begin the Q&A discussion. Feel free to ask any questions through the chat section at the bottom of your screen, or come off mute and just ask Sarah directly. Remember that Sarah is unable to give specific medical advice, so please keep your questions general in nature. This program will also be recorded and sent to everyone who is here tonight and those who couldn't attend.
And now we'd like to hand it over to our presenter, Sarah Field. Take it away, Sarah.
Hi there. Thank you so much. It's really nice to see all of your faces this evening. My name is Sarah Field, and I'm a clinical social worker. I work in oncology. Currently, I work in DC at MedStar Georgetown, and I work in a breast surgery center. So my role is primarily supporting people around the emotional and practical impact of a cancer diagnosis. And so I'll share with you today some information about the way that the work that we all do, whether you work as a clinical social worker in a cancer center like I do, or you are serving as a volunteer, an ambassador, a staff member, the way the work impacts us all. So I will go ahead and share my slides so that we can all see it together. Let me just make sure that you can all see that properly.
Yes. Yeah, we see it.
Wonderful.
We still see the notes.
You do?
Yeah.
Yeah.
Switch the display.
My apologies. Let me just redo that.
Perfect.
All right. So, like I said, today we're going to be talking about vicarious trauma and the related concepts. So that includes things like burnout and compassion fatigue. And the work that we do is challenging. We are exposed, regardless of our roles and responsibilities, to suffering, to people who are going through challenges. And so this can really lead to our own suffering too, which is why it's so important that we attend to these impacts and to ourselves. So I think of vicarious trauma coming from a health setting as I do, sort of like occupational hazards, just like nurses and physicians and other healthcare providers face things like needle sticks or exposures to body fluids or viruses, etc. Just like in a hospital setting, we need to actively work to have precautions in place to protect ourselves. When we're facing the occupational hazards of bearing witness to other people's suffering, we also need to have some precautions in place. And I want to just start tonight just by sort of grounding us in the present moment and just taking an opportunity to slow down and to do a breathing exercise together. And so I invite you to just take a moment to notice how your body is in space right now. Perhaps you're sitting on a chair like I am, and you might notice how your feet are feeling on the ground. maybe how your feet are feeling in your shoes or your socks. This might be the first time all day that you've just noted how your feet are grounded, really rooted into the earth. Just taking a moment here as we begin tonight to soften any tension that you might feel in your forehead. Letting your jaw just loosen just a little bit. You might bring up your shoulders a little bit, sort of exaggerate it, and then just let them fall down, releasing any tension in your body. And we can just take a few deep breaths together, just as we're centering ourselves, inhaling and exhaling. Noticing how that air feels through the nostrils as it fills up your lung and your belly. And how it feels, maybe creating a little bit of warmth as it leaves on the exhale. Just taking a couple more breaths here. Centering yourself for this presentation. Thank you for engaging in that grounding practice. I hope that helps you feel present for the session. I also want to offer you all some reflection. I want you to take a moment to search inside for what are your motivations as a helper? What brings you to this work? And just think the answers to yourself if you like. Asking yourself what reason led you to choose this path. Thinking back to a time in your life, maybe when you decided to work with Share or to volunteer. What life events shaped your motivation? The motivations and the life events that draw us to engage in these sorts of programs and organizations can really define who we are, both as a person and as a helper. And in times that are hard, where we're really feeling like we're being impacted by people's suffering and the work that we're doing, it can be helpful to just take a step back and to remind yourself, what's your why? What brings you meaning? Before we get too far, let me share a roadmap for how we're going to be spending the next 30 or so minutes together this evening. So I will define vicarious trauma, and we'll also go over some other related concepts. We'll talk about what it looks like. What are the symptoms? What are the things that put us at risk? What are the things we can do to prevent it? And also, how can we learn a little bit more about self-care? Before we go over definitions, I want to share with you a couple of quotes that just really resonate for me. And so the first is by a physician named Dr. Rachel Remmel. And she said, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as being able to walk through water without getting wet. This work impacts us. And I also want to share this quote from Dr. Charles Figley, and he's a psychologist who's really credited with coining the term secondary traumatic stress and did a lot of research in this phenomenon. And he realized that when we are caring for people who are enduring trauma, we ourselves are susceptible and at risk for some of the same symptoms that people who are actually experiencing the trauma are facing too. And so he says, we've not been directly exposed to the trauma seen, but we hear the stories told with such intensity, or we hear similar stories told so often, or we have the gift and the curse of extreme empathy, and we suffer. We feel the feelings of our clients, we experience their fears, we dream their dreams, and eventually we lose a certain spark of optimism, humor, and hope. We tire. We aren't sick, but we aren't ourselves. Something I've observed over time is that those of us who show up in a helping profession or a volunteer capacity are oftentimes incredibly empathetic and compassionate, and yet we sometimes ignore our own needs and don't extend that same compassion to ourselves. And so we'll talk a little bit about tonight about what that looks like and how we can do it. throughout the presentation, I'm going to ask just a few poll questions just to engage you all and see where you're coming from. So I want to just ask our first poll question of the night. If you could respond anonymously. Before this evening and before you learned about this webinar, had you heard of secondary trauma or vicarious trauma before? I'll just give you all a couple seconds. Hopefully that's enough time. Were you able to see their responses?
I think I sent.
Oh, thank you so much. Now I can see them too. So it looks
Yeah.
like we've got about a third of people who've heard of it, and 2/3 who haven't. And so I really appreciate you sharing that. And I'm confident by the end of the presentation tonight, we're all going to know a little bit more about vicarious trauma. So that we're all starting from the same place, let me share some definitions with you. And so one of the guiding pieces of this presentation is really to the fact that everyone who's witnessing trauma is impacted and exposed to other people's trauma, and that puts us at risk. It puts us at risk for something called secondary or vicarious trauma, and you'll hear me use these terms interchangeably this evening. They're the exact same thing. And what vicarious trauma is it's the emotional, psychological, and the physical responses that medical and mental health providers, including volunteers, may experience when they're exposed to the traumatic experiences of our patients. And a very closely related concept, and sometimes actually conflated as the same as vicarious trauma, is something called compassion fatigue. And that's the emotional suffering and the physical exhaustion that can result from prolonged exposure to other suffering. And it occurs when the experiences that we're having are starting to really impact our thoughts, our moods, our emotions, especially outside of the work that we're doing. And then lastly, I want to share the definition for burnout with you all. And burnout's a chronic physical and emotional state of exhaustion. And it's oftentimes accompanied by the feelings of cynicism and detachment from our job, and a real sense of reduced personal accomplishment and effectiveness. Now, interestingly about burnout is that this is a progressive state. It's something that occurs cumulatively over time, really an occupational hazard that's related to low job satisfaction and also low organizational support. Now, interestingly, even though burnout has a lot of the same symptoms and even some risk factors as vicarious trauma, it differs because secondary trauma and the exposure to other people's trauma is not really the precipitating factor in burnout. It's really much more about unsupportive work environments and being powerless and overwhelmed at work. I'm going to ask you all a second poll question. I'd appreciate knowing, in your experience, how often do you feel emotionally impacted by the work that you're doing with your support group participants? If we can see the results when they're ready. Oh, perfect. So it looks like we have a bit of a distribution here. Some people are feeling very often impacted. A large number are saying sometimes. Got some rarely and some often too. So a real diverse range of answers. Thank you. I want to share with you this model It's actually from the Office of Victims of Crime, but really does translate to the type of work that we're all doing, working with people who have or had cancer. And so this is a model that introduces a little bit of a new concept for how we think about and conceptualize vicarious trauma. And I included a QR code just in case you're interested in learning more. They have some really interesting information in their toolkit. But what this model is telling us is that really any work-related trauma exposure is vicarious trauma, potentially. And this model goes on to say that a change in your worldview is inevitable because of the work that we're doing and the trauma that we're exposed to. Now, there can be negative changes in worldview. For example, you might become more cynical or more fearful, but there can also be positive changes in our worldview. We might be more appreciative of what we have. We might gain better perspective. The other thing this model says is that there's various responses that people can have in the face of witnessing trauma. So today we're primarily talking about the negative impacts of trauma, right? So that's the vicarious traumatization, secondary traumatic stress, and compassion fatigue. And we can move between these different buckets, if you will, person to person, as well as just based on how you're doing. But when we're thinking of vicarious trauma or secondary traumatic stress, we're thinking about the ways that the work impacts us negatively. But there can also be neutral impacts. So for example, let's say an individual is very resilient, they've got a lot of experience, support, effective coping strategies. Well, then the trauma material that they're exposed to might actually not have much of an impact because you might be able to manage it effectively. And then there's also positive impacts of the work that we do. Really, this is why many of us continue to do this work, I think, is because we get a lot of meaning and purpose. And there's some newer concepts, for example, vicarious resilience and vicarious transformation, that says that we might draw inspiration from patients' resilience. And it might strengthen our own mental and emotional fortitude. And so just like a cancer survivor can be really transformed by their own experience and diagnosis, we too, by bearing witness to that transformation, can also be transformed. I want to share with you some of the symptoms and warning signs of vicarious trauma. And these are not just emotional symptoms. These are also physical, behavioral, changes in the way we're thinking. And I will offer to you a lot of different side effects and, often or symptoms. And most of us won't experience all of these, but I invite you as we're going through them to be curious about how are these symptoms showing up for you? What are your warning signs or most sort of frequent symptoms if you're being impacted by the work? And so first we'll talk about the emotional symptoms. And so this is feelings of hopelessness, feeling powerless, maybe having heightened anxiety or fear, being particularly irritable. Mood swings and emotional exhaustion are common here. And then you also might have intrusive thoughts or nightmares about a patient's or group member's experiences. Some people also report feeling diminished sense of joy or difficulty talking about their experiences. There are also physical symptoms. And I think a lot of times we're not as tuned into our body and how things are showing up for us in our body, but you might be fatigued or have difficulty sleeping or insomnia. You might have headaches or body aches, changes in your digestion or your appetite, eating much more or much less perhaps. Another big one here is trouble with intimacy. There are cognitive symptoms, difficulty in concentrating or making decisions, trouble remembering things or feeling like you're cognitively overloaded. You might be hypervigilant or feeling like you're constantly alert. You might also have an exaggerated startle response. And then lastly, behavioral symptoms. So you might withdraw from colleagues or friends. You might skip work. You might feel less satisfaction and even some burnout. You might experience decreased empathy or compassion towards others or yourself. And then some people do start using substances as a coping mechanism. And something I like to tell people, so we're talking about a few concepts, right? We're talking about vicarious trauma, we're talking about compassion fatigue and burnout. And I don't think it's important that we're with 100% accuracy diagnosing ourselves. I think the most important thing is noticing when we're not ourselves, noticing when something is wrong, noticing when we are being impacted by the work that we're doing and when we need to do something to really counteract that and perhaps get some support. I want to ask you a third poll question. Which of the following emotional symptoms have you personally experienced related to your work with cancer survivors? And here you're able to answer and whatever choices are right for you. Okay, so it looks like people are reporting a number of different varied responses, different emotional symptoms. And I so wish we had the capability to capture what your other comments were. Perhaps there'll be an opportunity to discuss that in the reflection and Q&A. But what I'm seeing here is sort of what the research and my learning reflect, which is that this work impacts us emotionally. I want to share with you all some risk factors. Hopefully by now I've sort of convinced you that we're actually all at risk just because of the work we do. The bearing witness to other people's suffering puts us at risk for secondary trauma. But there's some other specific impact or risk factors that you should know about. So one is prolonged exposure to traumatic events and a lack of emotional support and debriefing. Perhaps in the workplace, for example, if you were to feel like you didn't have a community of people or a safe place to talk about what you were experiencing and witnessing. Social isolation and a tendency to avoid or have difficulty talking about your feelings. A personal history of trauma or mental health issues, especially those that are untreated, can put people at increased risk. And inadequate self-care practices. Now, interestingly, even though prolonged exposure to traumatic events does put people at risk, this isn't necessarily cumulative over time. And so, for example, what we see in nurses working, for example, in the ICU, is that it's actually the newer staff, the newer nurses who have less experience, maybe less support and less training, who are most impacted and experience vicarious trauma compared to more seasoned nurses who maybe have developed over time strategies to cope. I want to talk about prevention. That's really key. You know, we know the problem now, which is half the battle, but really what are we going to do to treat this? What are the antidotes to vicarious trauma? And so the first is really self-care, and we're going to have an opportunity to talk more about self-care tonight, but things like prioritizing regular sleep, exercise, healthy, nutritious eating, engaging in your hobbies. What are the things that you enjoy? What are the things that help to relax you? Are you doing them? Also practicing things like mindfulness or meditation, deep breathing, like we started the session with tonight. Having access to professional support is really helpful with prevention as well as treatment. And so having the opportunity to have regular debriefing sessions, to talk to a colleague, or even seek out a mental health professional if that's what you need. And also being able to seek supervision and counseling to process your emotions. Establishing boundaries is really critical to prevent vicarious trauma and burnout. But that could look like preventing or preventing becoming overly involved by having solid boundaries. It could also mean learning when to say no. When you recognize for yourself that saying yes to one more thing is going to be overwhelming, just having the opportunity to practice saying no. Education is key. So, just like you all are learning about this tonight, there needs to be more training on recognizing and managing secondary trauma. And we also need to understand the importance of asking help. Because I work in healthcare, I am always struck. I've worked with medical students, residents, physicians, and really none of those professionals, nurses included, have the opportunity to learn about secondary trauma in their education. And so they get essentially on the job training when they're exposed to the trauma in real time. And so I really appreciate that SHARE is prioritizing the importance of talking about a concept like this and prevention and self-care so that we can hopefully help you all before you're feeling too overwhelmed. And lastly, for prevention, I want to talk about workplace support. I know that not all of you are employees of SHARE, but in organizations that are working to prevent vicarious trauma, really creating a culture of openness, of good communication and support, having access to something like an employee assistance program for counseling, ways to talk about the impact work is having on you, and also the opportunity to rotate tasks so that you're able to reduce the constant exposure to trauma. That might come up more in like a bedside nurse example, but I think it's important for us to reflect on too. Are there things that we're doing repeatedly that are impacting us? I want to offer you this metaphor that's really helpful to me. It's by a psychologist named Dale Larson, and it's the helper's pit metaphor. And so here you can see you've got sort of a crude drawing of a pit, right? And you've got your patient or client or group member in the pit, and you yourself are standing on solid ground. And what this metaphor says, and what Dale Larson says, is that if you over-identify with the person in the pit, you'll fall in. You'll be in the trenches with them. But if you do fall in the pit, you're not able to think objectively. You're not able to act helpfully because you're going to be caught up in your own emotional reactions to what the person is going through. The person's in distress, and now you yourself are also in distress. And I think another really important thing to know is that the people in the pit, even if it feels like it, don't actually want us in the pit with them. It makes it pretty scary because they're going to feel more helpless and more powerless because they don't have somebody on solid ground to help them. And so for myself, if I'm engaging in a relationship with a patient and I'm just feeling like, you know what, maybe my boundaries aren't where they need to be, I'll ask myself, where am I? Am I in the pit? What do I need to do for myself to get myself to more solid ground? Because I'm not able to throw a rope, so to speak, or a ladder or lend a hand if I'm physically in the pit with them. We're both then really stuck. So when we're talking about the impact that this work has on us, there's actually a formal tool that we can use. It's called the Professional Quality of Life Scale. It's a 30-question item. Obviously, we don't have time for that tonight, but it does break out the results into 3 different scales around things like compassion, satisfaction, burnout, and secondary traumatic stress. And it's a validated tool that you can find online. But the other thing, most of us aren't taking out a questionnaire every time we're feeling a little bit activated. So we can do a personal assessment. We can do some more reflection. We can ask ourselves questions like, how am I doing? What do I need? What's the hardest part about this work for me? What worries me most about this work? What changes in myself, if any, am I seeing that I don't really feel comfortable with? What's my sense of personal accomplishment in this work? And what am I doing to take care of myself? Just checking in with yourself sometime. Asking yourself what you need and how you're doing and how the work is impacting you can really be helpful in giving yourself space to process and to also just normalize and validate what you're going through. We'll switch gears a little bit. And I told you, one of the keys to prevention is self-care. And I think self-care is, it's been a buzzword now for a really long time. But I like to sort of joke that if Instagram quotes were the answers, we would all be absolute experts in self-care by now. We see these memes of, you have to put on your own mask first, or you can't pour from an empty cup. Self-care is really not that simple, right? We can't just be looking at Instagram memes, of course. The other thing is that self-care is not things like massages or manicures. They're not appointments that you can book or something that you can fail at. They're not a competition. Self-care doesn't really cost very much money. The other thing about self-care is that it can be really small. We can practice something called micro self-care. And that might be just checking in with yourself mindfully. It might be asking some of the reflection questions we just did together. It might be practicing awareness of when you're numbing. So for example, when you notice yourself trying to avoid difficult emotions or feelings, when you're scrolling social media or you're eating mindlessly. I also want to share with you that, I tell everyone when I'm talking about this type of concept is that there's nothing wrong with you, right? It's not us, it's the trauma. The fact that we're exposed to the trauma means we need to actively work against it and to care for ourselves. I'm always struck in healthcare, and I'm sure in many of your roles, you are in a one-sided relationship much of the day, or at least maybe much of a session. And so we are giving and giving and bearing witness to a lot of trauma, but we don't necessarily have folks who know what we're feeling or what we're enduring. And so it's important to practice self-care throughout the day and at the end of the day as opportunities to release. I think of it like a pressure cooker. If we don't have a release valve, if we don't have ways for ourselves to let off some steam and to restore, then we're going to explode. So I'll ask just one last poll question. I really appreciate everyone's engagement with these, but I want to ask, how often do you engage in self-care practices to manage the potential effects that you might experience working with people with cancer? So it looks like, again, we have a bit of a distribution, but mostly folks are falling into the occasionally or the regularly camp. About 14% are rarely or never, and just a handful looks like we're doing this often. I hope today we'll be able to convince you why it's so important that we engage in self-care and what that can look like. I'm noticing, I'm not sure if you all have some yellow on the screen. I'm not sure what's the cause of that, but hopefully it doesn't take away from your ability to see the material. But let's talk about self-care. So self-care is first a balance, a dance, if you will, between awareness and practice. Now, what do I mean by that? So I think oftentimes we think of the practice, the active things that we're doing to take care of ourselves. But there's also a really important component of awareness. So what do I need to do to take care of myself today? Without that awareness, we aren't necessarily going to be practicing effectively and doing the things that work. And self-care is also a balance between effort and release. And so again, I think we often think about the effort, the action-oriented work, what are we doing? And we don't always pay as much attention to the release. And that's more about acceptance and offering ourselves some grace. And then lastly, self-care is about practicing self-empathy. I think I started off today saying that a lot of us are really good at being really empathic and empathetic towards other people, but we don't always turn that same empathy towards ourselves. And so we need to really practice and strengthen those skills at offering ourselves some empathy. there's a yoga instructor named Elena Brower, and she offers the phrase when you're in a situation that's really emotionally activating you. She says to offer yourself, how human of me to feel this way. How human of me to feel this way when something like this happens. And just in recognizing your humanity and that it's normal and understandable that you're being impacted in this way, some of that judgment, some of that charge can just sort of loosen and fall away a little bit. Everything can get a little bit easier. You might feel a little bit better too. I think of self-care like a three-legged stool, and oftentimes, honestly, there's more questions than answers. And I wish that I could tell you all that here are the 12 steps you need to do. Here's your self-care plan, and it's going to work perfectly for you every time. But in reality, of course, that's not the way self-care works, because we're all so different, and what works for one person doesn't work for another. Also, what works for you in one situation or in one season of your life might also not work for you at another time. And so that's why it's the real root of self-care. It's important to be practicing asking yourself these questions. So cultivating your own self-awareness of what do you need? What do you want? What's going to help? And also cultivating the self-trust. What feels right for me? What feels true to myself? Not doing the thing that social media tells us we should do or some yoga instructor tells us we should do, but what do we feel that we need? And then also practicing self-compassion, asking yourself, what are the areas or spaces where I could give myself a little bit more grace? And like I said, self-care looks really different person to person, and it looks different situation to situation. And so that means that self-care could be in one moment saying no, and to something else saying yes. It could be having a good cry, and it could be having a good laugh. It might be giving yourself grace for making a mistake, saying, okay, I made a mistake, I'm human. But there might be other situations where it's important to take accountability and to make steps to repair. Sometimes starting to exercise, getting some movement in is helpful. And for other times, you might need to pull back. You might be overdoing it. You might need to give your body some rest. And that's self-care too. Sometimes it's being alone with yourself. Other times it might be being with family and friends. For some people, at the end of the long day, self-care could sometimes look like having a glass of wine, and other times it might be deciding not to. Similarly with sugar. Some people, you're cutting out sugar, you're wanting to really focus on healthy, nutritious eating. But then other times, it might be right for you to let yourself enjoy the sugar, to have the cookie or the cake or whatever is bringing you some joy. And sometimes you might be setting goals, really trying to achieve and follow through. And other times you might just need to do the bare minimum, honor your commitments as best you can, but not do too terribly much more. And all of this is self-care. Sometimes people will say to me, I am just too darn tired to figure out what it is that I need right now. And I think that all of us can probably relate to that at some point in our lives. And so that's where we can create really a personal go-to list or a menu, if you will, of options that work for us. What are your tried and true top 5 things that help you to feel calmer and more like yourself? And so these are just examples, but I feel like some heavy hitters that people tell me is being in nature, getting outside, going for a walk, taking a pause, doing some deep breathing, calling a friend or family member, maybe not even for events, but just for some support, some socialization, focusing on getting really good sleep and practicing more self-compassion. So I hope this motivates you to think about what are your go-to strategies for coping, and that you're able to put together a list that you can fall back on if you're needing some self-care practices. And like I said in the beginning, this is not because there's something wrong with you. This is something that we all need to actively engage in to prevent the trauma that we're bearing witness to. So So with that, I thank you so much for your attention and participation. And I want to turn it over to you all for questions, for reflections. I'll stop sharing my slides so we can all see each other.
Victoria, did you want to start the Q&A? Do we want to ask people who are live? Do they have anything? Somebody want to raise a hand, ask a question?
Why don't
Do
we
we-
try that? Let's see if anybody wants to unmute herself or himself. We actually have one man, right?
We sure do, and we got a good one.
And see if he or she wants to ask a question.
Well, I don't see
Nope.
I
Then
don't see any hands up. How
then-
about that question number 3 that was
that's
submitted?
right. Let's go with that.
Okay. How can I practice self-care after an emotional support group or helpline call? And we can add to that, or in a professional setting.
Okay, refresh my memory.
What comes to mind for me is a couple of things. One is hopefully having a continuous practice of self-care, you know, those micro self-care moments that I talked about throughout the day where you're checking in with yourself. And then things that you're doing maybe in the evenings, at your lunch break, on the weekends that are restorative for you. But then having your things that you can do after that emotional group or a hard day at work. I know for me, exercise is really key. So it might be going out for a walk. There might be the sort of desire to sit on the couch and veg out. And I might give myself that grace for a short while. But when you're sort of gaining some self-awareness about what works for you, for myself, I know that eventually I need to get off the couch and I need to go outside and I need to get a little bit of air and space from what I was going through. I wonder if anyone else has thoughts about, you know, after an emotional group, what you all do. If you want to put it in the chat or share, if you want to unmute yourself.
Well, after I have an emotional group, I'm a talker. I don't hold the things inside. So if I have an emotional group, I also encourage all the volunteers on the ovarian helpline, if they handle something, and I read the logs, I have them call me immediately if they are, you know, I'll use one of those words, triggered, you know, by something. But, you know, I have to talk it out, especially, I mean, you know, it's interesting. One of the most interesting things that I found from this is that I know the mood swings and things that get me going if I'm feeling stressed out or having this burnout, feelings of burnout. But on your slides, and a tribute to you, I screenshot about 5 of them. The positive impact that where you know, where you can get vicarious resilience. I mean, I'm kind of a glass half full person, even though, you know, we all go through these things where we feel so bad for the person we're trying to help because they're really in the soup, and you know, you can't fix it. You know, you're pretty sure where it's going because you've been doing this for a long time. But that vicarious resilience, I think that that's something I'm going to concentrate on in the future. And I thank you for that, Sarah.
Well, I guess I'll chime in. I have to say I'm very, very lucky because I don't run a support group alone. I have a co-facilitator and a friend, and we run it together. And it really helps after a very difficult group. And we actually had one this week that was really, really difficult to just talk share after the group. I think to me that's the best thing we do after each group. We just chat for a few minutes, and it helps us decompress and move on. But I guess I wanted to ask something that came up before we started this session, and I thought it was important to ask. There are some of us here on this webinar are employees, and there are quite a few of us who are volunteers. So that in a way gives us freedom to stop. And so the question that I have, and I've been grappling with this for a while myself, and I know a lot of people have too, when do you know that it's time to stop, take a break, and maybe walk away? When you are an employee, it's harder because there are things that you have to do, like, you know, insurance, medical insurance, paycheck, obviously. But as a volunteer, we have a little more freedom. So in your opinion, what would be a sign that you've had enough and it's time to take a break and walk away?
Yeah, I think it's really important for us all to ask ourselves, and I'm thinking back to the reflection questions that we started with this evening, of what initially motivated you to do this work? What motivates you to do this work now? How are you feeling at the beginning of a group, for example? How are you feeling at the end of the group? Are you feeling like you are making an impact in the way that you want to make an impact? Are you still gaining meaning from this work? And I think sometimes giving ourselves permission and giving ourselves some grace to say, you know, this work is really hard, and I've given what I can give right now, and I need to turn inward or get my own support and step away for at least a time. I mean, I think that that's really a valuable gift we can offer ourselves. And I think it's actually a really sort of selfless gift that we can offer other people. I'm also thinking of that helper's pit metaphor. And so if we're not able to maintain those boundaries, if we're not able to stay out of the pit with the participants or the people we're helping, then what are we doing? Are we being effective? Are we helping ourselves? Are we helping others?
Thank you. That's very helpful, actually.
I have a question.
Okay.
First of all, I want to preface it by saying the question is not meant to impugn the wonderful organization that I volunteer for, or the wonderful co-facilitator of mine who appears in one of these screens. What if you're part of a small organization and you recognize that either yourself or others in that small group have been traumatized, but the group or organization has no support structures within it to help you and others manage that trauma? What do you do in that case?
Yeah, I think that's an important question. And I think something that a lot of organizations are grappling with. I work at a major hospital center that, you know, I don't have to remind you, just went through tons of trauma from COVID. And so I think it's really an opportunity to take stock of what supports do we have in place, what challenges are the people who are volunteering or working with us facing, and how can we meet their needs. And I don't think it's a one size fits all. I think sometimes it also requires some courage from the folks who are on the front lines to say, this isn't working and I need some help, and maybe even trying to be a little bit of a part of the solution.
Thank you.
I'll also just add that I think just having this conversation speaks to the fact that Share is invested in and understands the impact that this work has on all of us.
Sarah, I want to thank you for this, and certainly Share as well, because I think this is so important. I work with trauma and domestic violence and stuff during my day job. So this, I have to say, this is a wonderful topic and presentation. The thing is that self-care is so important. And sometimes I think we practice it without even realizing it. I know myself, music is important, and I have a go-to artist. And whenever I'm kind of like maybe feeling that I am over, kind of having, difficulty processing without realizing it, I find I think now that I'm always with that same artist. So I think that oftentimes we practice self-care without even realizing it.
I think that's a great point, Colleen, and it sounds like you have a long practice of sort of checking in with yourself and what works for you, and so you've got that like go-to thing that you probably don't even have to think to yourself, like, okay, I'm activated, I need to engage in self-care, let me pull up my playlist, but you're just doing it automatically, and that's sort of the beauty of practicing self-care. Just like we go to the gym to strengthen our muscles, once they're strong, we can call on them when we need them. And we can do the same thing with effective self-care practices.
Can I say a word? Hi, I wanted to respond to, I see the name is Andrew. I think an important part of that is to educate, whether you're I don't know how big an organization you're talking about, if it's 10 people or 100 or 1,000, but we have to educate, I'm a social worker also, you have to educate those around you that this is something that's needed. Not that it's easy to start any kind of program or philosophy like that. And then if it doesn't suit you or give you the satisfaction you need, as you said before, the time to quit is when when you're bringing too much home with you, when you can't get it, out of your head or off your plate, and more important, I think, to affect everyone around you, whether it's a spouse, a partner, children, parents, whatever it might be. When it starts that mobile starts going round and round and round, and it's just like a crazy helicopter, then it's just not good for you. It's not a good fit. And there may be a better place that you can, put your services to better use and better care of yourself. That's the most important thing, because you can't help anybody else if you don't take care of yourself.
Thank you, Deborah.
One thing that I do want to just sort of offer as a caveat is, so we went over the symptoms of vicarious trauma, and I told you, for example, a symptom could be like a sleepless night or intrusive thoughts. And, I know for myself, I've been doing this work for a decade or more, and sometimes, even despite my self-care strategies, despite my boundaries, despite the things I'm doing to prevent the impacts of the trauma, that still happens to me. And I think, just gaining some awareness of how are the impacts showing up for you, how can you mitigate and assuage them, but just also giving yourself some patience and grace and empathy. And that phrase comes back to me of the how human of me to feel this way.
I actually wanted to ask a question that came in to us, and it's a little off topic, but because I run support groups, and it actually speaks to me, so I wanted to ask that question. So the question was, in a support group setting, when something really terrible happens to one of the members of that support group, and that, in the metastatic support groups that we run, that happens quite a lot. How do you propose to manage the group grief? How do you handle this situation when this horrible thing that just was talked about? So how do you manage that? How do you try to manage that?
One thing that comes to mind for me is really turning that to the group. If you're thinking that, I bet other people are thinking that.
Absolutely.
How are you holding space for each other? How do you as a group want to process? And if it's a loss, for example, how do you want to honor and remember and reflect? I think opening it to the group, because if we put too much pressure on ourselves as facilitators to know everything and know all the answers and how we're going to do this perfectly, then we're going to be overwhelmed, I think. And we're also not opening it up to the group and giving the group members credit for knowing what's going to be most helpful to them.
I think you want to encourage them to talk about what they're feeling, the impulse, the instinct would be like the elephant in the room. No one really wants to talk about it, but the opposite is true. And I think once you get one person to start opening up and saying what they're feeling, they're afraid it might be myself next or whatever, you know, it might be. Suddenly you're going to get a tremendous flow. And eventually I think that's going to offer relief. I think it's much better to talk about it. And if the group doesn't, if no one offers that, I'm not a facilitator yet. I have in outside work, but not with Cher. But then try your best to learn how to facilitate that and encourage whoever it is going to be the person who starts that kind of conversation, or as you get to know the group, but definitely to try to encourage them to talk about it and to say it's a safe place, most of all, which they probably know by then, I'm sure, but still to focus on that.
Thank you. Thank you. That helps. But I have actually I have a follow-up, and that was not, that's my own question. And we've been grappling with that as well. So there are groups that are lighter, and then there are groups that are very difficult, and especially the difficult ones. It's very hard to end. You know, what is the best way to end a difficult group? Because you don't want to just say, okay, goodbye, see you next week. You want to do it on a something that would leave them in a little bit better state.
Yeah, I think that's also where opening it up to the group. You know, if you have people who are coming, you have a recurring group of people, you know, how do we want to start groups? How do we want to close groups?
Right.
Letting them know that you're going to give a 10-minute notice, that there's 10 minutes left. And, you know, is that the opportunity to switch gears and to maybe have a bit of a ritual or a practice that you all do together? I think that's an important point because, yeah, whether you're a therapist or you're in a group, there is the desire to end things in a little bit of a lighter way, or to put a little bit of a bow around something, and to not all log off Zoom, for example, you know, just feeling really intense emotions. That might even look like just taking some breaths together, or sharing an emotion that came up for you. Or, I mean, I think the options are really endless, but opening it up to the group to see what they think might be most helpful seems like a really good idea to me. That's the beauty of the group. As a facilitator, you really can ask the group what they think, and they'll tell you.
Yeah, that's true. Thank you.
Well, Sarah was talking about a 10-minute warning, and I've been given this
You're
job.
giving a 1 minute warning?
A 1 minute warning. So if somebody has a burning question, you know, please feel free to ask it. I'm looking for hands raised on this thing. I'm looking in the chat. And I did want to mention that when we were talking about what to do when you have a difficult group, that Karen wrote in that you can journal. You can write things, you know, in your journal. And Michelle wrote in that when we were talking about the positive impact, that's, you know, growth post traumatic experience, that you can grow from the experience. So, you know, even though I'm not a big fan of chat, I just want to put that in there because it's important contributions. And so now I'm going to say we're out of time. And I want to thank Sarah for just a fabulous, informative program. And I want to thank everybody on this Zoom for participating. But really, I want to thank you for what you're willing to do for others time and time again. You really are a terrific group of individuals. And I hope that you get and continue to get satisfaction and reward.
And I want to chime in here too and say thank you from the bottom of my heart for what you do. And it's hard. And it's true that there are days when you say, I've had enough. And then we show up. We always show up. So please take a moment to fill out the survey at the end of the program. The survey will show up in the browser when the Zoom ends. All surveys are anonymous. So this concludes our program. Thank you all very much for being here, and have a great night.
Thank you.
Thank you.
Yeah.
Thank
Thank
you.
you, Victoria and Andrea, for hosting
Thank you.
the reading.
You all.
Thank you. Very informative.
Sarah.
Served in the same house for 10 years.